How you doing today, guys? My name is Dr. Steve Goninan with Alexander Spine Center in beautiful Johns Creek, Georgia. And what we're going to talk to you today is about something that afflicts a lot of people, especially athletes like runners, and that's called the IT band syndrome. Okay? So this is not your typical IT band instructional video about how to roll it. Rather, what I wanted to do is more or less talk to you about what the IT band is and why it becomes problematic for certain people, okay? More importantly, I want to talk to you about what I feel like, in my experience, is the real root cause of most IT band syndrome. Okay, for starters, let's define it, right? So the IT band is this long band of connective tissue that goes down the side of the leg. In fact, if you could just follow the seam of my pants leg there, it really runs from almost here, from the pocket, to the outer knee, right here, okay? Two muscles primarily make up the tendon of the IT band. So you have this muscle here in the front. It's literally about the size of my hand. Goes right here, and it's called the TFL, which stands for tensor fascia lata, and that is not a drink that you can get from Starbucks, okay? But the second muscle group that contributes fibers into the iliotibial band is going to be back here, and these are called the gluteus medius and the gluteus minimus. Now, these muscles back here, the gluteus medius and minimus, they will sometimes, be known as the hip abductors, in that they do hip abduction, which is this motion. But I think their bigger role is stabilizing the pelvis laterally, especially when you're taking a step and all the weight of your body is being stabilized right here through the gluteus medius and minimus. So they're, I think, more important as pelvic stabilizers than they are hip abductors, okay? But the tensor fascia lata is an assistive muscle. It assists in motions like hip flexion and hip extension and abduction and bending. And so as an assistant muscle, it assists in a lot of different motions, but it's not the primary mover of any of those motions. So when you have an iliotibial band, so named because it starts from the ilium of the pelvis and finishes at the tibia of the lower leg, the IT band is a whole lot easier to say than iliotibial. When you have a tight IT band, the reason isn't because everything here is gone tight. The reason is because either the TFL, tensor fascia lata, or the gluteus medius and minimus, as pelvic stabilizers, have gotten abnormally tight, or there's become asymmetry in function in the lower back, or there's been injury. Almost always what has happened is this motion here, which is called hip flexion. The main movers of hip flexion, the psoas and the iliopsoas, have gone weak. And as they have gone weak and lost the ability to do this, the tensor fascia muscle has tried to take over. Now here's the thing, when you take a muscle that's an assistant and it's not a main mover, and all of a sudden it tries to become the main mover, it's going to become overworked. It's not built for the job. And as such, this muscle gets tight, it's going to put a greater pull into its portion of the IT band, which is essentially a long tendon, which attaches this muscle down here to the knee, okay? So a tight IT band starts up here with either a tight TFL or tight, pelvic stabilizers, usually due to a weakness in the hip flexion or due to a weakness somewhere else. It's really important, guys, before you start looking up other videos on YouTube or around the internet and start rolling the absolute heck out of your IT band, that you understand that there's a reason why the IT band got tight and inflamed, okay? Some people can't help it. If you take a guy like me who's bow-legged, I'm gonna naturally have tight IT bands, but that doesn't mean they have to be inflamed. Runners tend to get it more because, remember, the TFL does assist with both flexion, extension. These muscles back here assist with stabilization, which you need with every step of a run, and it's just overuse. When I treat guys that do marathons or triathlons, they're actually logging in a whole lot more miles than your average runner. They tend to suffer with it. Athletes in sports like basketball, where there's a lot of bending and jumping and sprinting, tend to get it as well. But almost always, when you examine these guys to find the cause and you assess the muscle function, these high caliber athletes can't usually hold this motion right here, which is the main motion of running, the main motion of jumping, you name it. So we can talk all day about how to stretch an IT band or how to roll it, and we do teach people to roll it here at Alexander Spine Center. But one of the things we have to do first is we have to reestablish the muscle tone of your primary hip movers, which are the hip flexors, gluteus maximus, and you got to make sure that your pelvic stabilizers up here are working, okay? So, before you start rolling those IT bands, guys, understand that there is a reason why they're tight in the first place. We help you get to the root cause of the problems, because that's what chiropractic does. We're cause-based. Is the problem something structural in the hip and the way it's misaligned in the pelvis socket? Is it something in the pelvis? Or is it just something that's plain old an injury to the muscle, and we have to reestablish that muscle tone before we can then begin treating the symptom? Every case is different, okay? And you can try things on your own, but if it's not working, if you keep beating your head against that brick wall and not getting anywhere, that's kind of the definition of insanity. If you're tired of suffering with that pain down the outside of your thigh or the pain in your knee, and you think you might be a candidate for having it assessed here at Alexander Spine Center and you're in the Johns Creek area, give us a call.